Zika is spreading in South Florida, and the stakes are high. When pregnant women become infected with the virus, their babies can be born with devastating birth defects. That's why health authorities have sprayed a pesticide from airplanes to kill the mosquitoes that carry Zika. But there's concern that the chemical being sprayed, called Nailid, may also be harmful to unborn babies.
It's essentially a neurotoxin and can result in unborn children in particular having neurodevelopmental problems.
The European Union has banned Nailid insecticide. And in Puerto Rico, where Zika has been rampant, people have demonstrated against Nailid, a type of organophosphate. The mayor of San Juan filed a lawsuit against the Centers for Disease Control to prevent spraying, saying, "There have been recent findings linking the presence of organophosphates and behavior problems in babies whose mothers were exposed to this type of chemical during their pregnancy." The CDC and the Environmental Protection Agency say Nailid is safe and the best option for killing these mosquitoes. The CDC points out that Nailid has been used extensively for years in the United States, that just 2 tablespoons are used over the size of a football field. This small amount does not pose a health risk to people, according to the CDC. So who's right? Will Nailid help stop babies from developing birth defects, or could it harm them? Experts say dozens of studies have shown that when pregnant women are exposed to Nailid, their children are more likely to develop behavior problems. But for the most part, those studies were done in agricultural areas where families lived near spraying for many years. They say the risks are much smaller in Florida, where the Zika sprayings have been done only 4 times. Dr. Barry Ryan at Emory University has done some of that research, and he supports the spraying.
Zika is a real problem. Children who suffer from this would not be able to cope with the real world. They will never recover from this.
He said Nailid can carry risks, but not nearly as big as the risk posed by Zika.